Over the past 20 years or so, we have seen a rapid growth of types of procedures in plastic surgery that involve buttock enlargement or gluteal enlargement. Previously, maybe in the previous generations, buttock enlargement was done solely with silicone implants that were placed under the buttock muscles. They were fraught with many problems, patients developing wound infections, capsular contracture of the implants resulting in buttock deformities. I was never for buttock implants because I saw some of the complications that were coming in through the door that I had to improve or fix. Fat grafting changed everything with buttock enlargement. We began to discover that during the performance of liposuction, the fat cells that are removed are actually partially still alive. And data over time has shown that somewhere around 50% of the fat cells that are grafted to any location can survive. Sometimes even more, up to 60% of the fat cells can survive. They can be living entities. So if you gain weight, those fat cells will become larger. And if you lose weight, the fat cells will shrink as if they lived there all their life. This process of buttock enlargement then took a safer shape in the sense that we were less and less using silicone implants or putting fillers, things that were done illegally in non-FDA approved presentation, which are horrendously risky if not performed by a physician. Fat grafting done in the right hands by board certified plastic surgeons is still risky, and it's not an operation that should be taken lightly, especially in the buttocks. There are risks associated with quote-unquote the Brazilian butt lift. The most important complication is that there have been a series of deaths with liposuction and fat grafting to the buttocks. These are related to the grafting of fat deep to the gluteus maximus fascia. So in all the studies that were done, they found that when fat was grafted deeply into the gluteus maximus fascia, there was a chance that this fat could embolize through the venous structures that are present inside the muscle. And embolize means travel to the lungs, make it to the pulmonary arteries, and cause a blockage, which is what we call pulmonary embolism, and that could be fatal. So it should be very important for any patient considering a gluteal augmentation or Brazilian butt lift to understand that this is not a simple procedure. It has to be done by the right surgeon. Caution should be taken to inject the fat below the dermis of the buttock skin and above the muscles, to not do very, very large volume injections, because the pressure of injection not only kills the fat itself if it's under high pressure, but it can also cause an increased chance of embolization. This is the new data that we're having, and it's important to perform these procedures with caution. They're still amazing procedures. They get the result that socially is now acceptable and desired by many people. I find that it's still a gratifying procedure, but we always perform it safely so that we have great results and a safe outcome.